Hi, I'm Prerana Issar. I'm the Chief People Officer for the NHS, and I'm in conversation with Sir David Behan, the Chair of HEE. Hi, David. So we are going to be publishing the People Plan for 2021, and I'm sure people want to know, why now?
Well, people probably know we've been working on the People Plan for about 12 months, and it was really important that we capture the learning that has taken place over the past 5 or so months as the NHS has been responding to this global pandemic caused by this COVID virus. I think the response to the NHS has been quite magnificent. Two or three things come to mind, Prerana. Firstly, the way that people have come into teams based on the skills they possess rather than the roles that they occupy, whether that's in intensive care, setting up Nightingale hospitals or responses in the community. We've also seen general practice use technology to undertake virtual consultations, easing access for many of us that want to consult our GP, but also improving the way that GPs can deliver that care. I think these are sustainable changes where we've demonstrated agility that we need to keep hold of. So the publication that we're bringing forward is to focus on the actions in 1920-21 financial year, where we want to really capture that learning that we've secured and ensure that it's built into the way that we operate going forward. But we also want to create a much more sustainable, compassionate culture within the NHS. Many of our staff who've worked incredibly hard over the past 5 months are tired, and we need to build in a way of actually promoting their well-being and welfare as we go forward. So an emphasis on an inclusive, compassionate leadership, supporting staff to be the best they can be so they can deliver the very best care for patients is really what we want to secure from the People Plan.
Thanks, David. And so let me share what we are going to be publishing, and I'm just building on what David has shared so compellingly. There are 4 areas in the People Plan 2021 that really form the heart of what people can expect from the NHS, from their leaders, and from each other. So we're focusing on 4 areas that we believe are crucial. The first is what David ended with, which is looking after our people. This was always important, but COVID has shown us just how much more we should be doing. And so we're setting out aspirations as well as expectations of the health and well-being support offer for all our NHS people. This includes support for individuals, support for teams, for line managers, for entire organizations. It's also a whole person approach. So it is about how we can support people with some of the secondary stressors that they have been sharing during COVID. The second area is belonging to the NHS. And here, one of the harsh realities that COVID has shown a light on is health inequalities and inequality within the NHS. We all belong to the NHS, and the NHS belongs to all of us. So the belonging aspiration and expectation has a particular focus on equality, diversity, and inclusion, and a focus on reducing and eliminating the discrimination that staff face on account of their ethnic background. The third area is new ways of working, and David has referred to that, how it's been incredible, the kind of service innovation we have seen, most of it led by our NHS people, and with the speed and agility that COVID required. So the new ways of working must be captured and built into a sustainable way of working. Fourth, by no means least, is growing for the future, which is about more staff. So we have more staff working differently in a compassionate and inclusive culture. So this is about recruiting, retaining, and returning options for our NHS people. So let me go back to David and ask him, what do you think people can do right away, David?
Well, I think the focus in this plan is for action in 2021. We know we need to do further work because we're still learning about this virus. There are still things we need to learn and digest about the way the virus behaves, but also we need to continue to extract the learning from how the NHS and indeed the social care system has responded to the virus and how we can continue to build. So as we prepare to go into winter, are we prepared for a second spike? Are we continuing to build on some of the things you've just shared with us, Prerana, those 4 elements of the plan, and ensure that those changes are sustainable as we go into winter? But as leaders, I think one of the things we need to do is ensure that the vision and the principles in the people plan about compassionate leadership, about valuing and supporting staff, continue to be at the fore of our response to COVID-19. As a minimum, it's our duty to ensure that all of our staff feel safe. That's physically, emotionally and psychologically safe, and creating that environment, I think, is one of our leadership challenges. But I think we need to ensure that we continue to promote the importance of equality and inclusion in the way that we lead the services and the way we support each other. What we know from this virus is it's had a terrible impact on people who are experiencing inequalities in the way in their life opportunities. We know it's had a disproportionate impact on staff of Black, Asian and minority ethnic backgrounds, as well as communities of people from Black, Asian and minority ethnic backgrounds. And one of the things that I've learned as a white leader is just how important it is that I recognise that, and I'm taking active steps to promote this safe, psychologically safe and physically safe environment for all of our staff. And because of the disproportionate impact that this has on our staff from Black, Asian and minority ethnic communities, how we can pay particular attention to that. So the risk assessment strikes me as being hugely important as a basis for a conversation between managers and staff about how we can promote their well-being as we go into the next period of time and into the winter.
Thanks, David. That's really, really well said. So what happens next? The publishing of the plan is it's not the beginning, because we've already been working on this with hundreds of stakeholders and tens of thousands of our NHS people for a year. So publishing the plan is really part of that conversation, and that work will continue. We will continue to co-create our collective aspirations and commitments along with all of you, along with boards and exec teams. So we have the Winter Health and Wellbeing Plan and Focus. We will be publishing resources, guides and tools. We'll be working directly with boards and exec teams, and a new approach to education and training for clinical roles for a more flexible, modern NHS in collaboration between HEE and NHS EI.
What we want this people plan to achieve is for the NHS to be the best place for people to receive their care, but also the best place for staff to work as well. That's our ambition, and I hope you'll see that the plan begins to set out some further steps that we can take to achieve that goal.
Fantastic. Thank you, David.
Thank you.